So let's be frank. Contact lens wearers frequently encounter problems with their lenses. And in our practices, we realize that the question is not really if they're having problems, but when they're going to have problems. Now, although this isn't the case for every single patient 100% of the time, we do realize that if we ask the right question, we can usually elicit some type of discomfort from the patient. Richdale studied 453 current and lapsed contact lens wearers, and he discovered that 73% of them reported one or more symptoms with their contact lenses. Both of us like to ask our patients how they're doing with their lenses, and what we used to find is that most of them reported that they were doing fine. If we didn't see any of the issues on the ocular surface, we then proceeded along with the same lenses that the patients were wearing. But as practitioners, we really want to look to see if there is some sort of correlation between what we're seeing on the eye, the symptoms of the eye. There was an evaluation done in 2012, which was a market study that looked at how practitioners view contact lens dry eye. And 25% of the practitioners placed the most emphasis on the symptoms. 19%, their preferred method was corneal staining, and 11% for tear breakup time. I guess the point I'm trying to make is that with so many of our patients dropping out of their contact lenses on a yearly basis, maybe we aren't correlating the right things as far as signs and symptoms that our patients are experiencing. Maybe there's some other things and other ways that we can really target what's going on with our patients. For example, instead of looking at corneal staining, or instead of looking at just symptoms alone, maybe we can target inflammation and osmolarity and potentially lipid layer thickness can have an important impact with regards to our patients' long-term comfort. So as a result, we've started adding things like symptoms questionnaire, the SPEED questionnaire or the OSDI questionnaire, to see if we can find a way to more progressively impact what's going to happen in the long term, and then be able to look at those questionnaires over time. Other things is the inflammatory type of test. Although it's only one marker with regards to inflammation, if we see something positive there, it may indicate that there's an inflammatory component and the patient's having problems with their contact lenses. Osmolarity is another indicator, as well as looking at things like the meibomian gland oil flow, if there's oil flow coming from the meibomian glands or not. And those sort of things kind of indicate to us the type of treatments that we might want to dictate for our patient in order to be more successful in the long term as far as their comfort. Anything that's positive with regards to a patient's comfort getting worse and worse and worse over the last couple of years, whether the patient comes back and says, last year I was relatively comfortable, but this year I'm finding that I'm not, that indicates that it's not just the contact lens that's the problem. And instead of just switching from one lens to another lens to another lens year in and year out, or changing the solution, it's a good idea for us to address the ocular surface as the issue. Therefore, we make sure that the patient's in the best contact lens that's possible. And usually for us, that's a single-use disposable lens, whether it's a spherical or a toric. And we usually try to get a patient into a silicone hydrogel single-use lens if we can. Beyond that, we get really aggressive and proactive at prescribing either lifitegrast or cyclosporin for our patients. And as stated in some of our prior episodes with regards to how we treat dry eye, we also are very aggressive at making sure the meibomian glands are open and utilize LipiFlow or some sort of thermal pulsation and heat to make sure our patients' oil glands are flowing well. If we specifically target and really aggressively go after maintaining contact lens comfort in the long term, I think in the overall scheme of things, our patients will be much more comfortable and hopefully they'll stay in their contact lenses much longer, and we won't see that progressive dropout rate like we see so often in our contact lens wearers. And ultimately, I think that's one of the best ways that we can impact our patients' quality of life.